I've been doing nursing for almost 20 years. It takes me a while to get really kind of have that fear of uncertainty, but pandemic and COVID really did challenge me on that.
Really, it put a lot of strain on our resources, finding capacity in terms of beds, machinery, mechanical ventilators. All those things were stretched to the max.
We went from just looking after 16 to 18 patients in the hospital to having a critical care patients up to 35.
As time went on, we got more and more patients, and it got fuller and fuller, and wondering how, were we going to have enough nurses to take care of these? Were we going to have enough people to manage everything? And were we going to be safe?
That was very much a very loud message that leadership had for us, was make sure that you're taking care of yourself before you treat the patients. And that was a big focus on the donning and the doffing of the equipment, making sure that everybody was looking out for each other.
We've got an incredible foundation here, and our foundation has helped us not only with the monetary gifts that they're often providing to us and supporting us, but they showed up in a very tangible way, that they were on the ground. They were working in our emergency operations center. For them, it really gave them a front row seat to what was going on in the hospital and what were the needs. And then they were able to be there in a very present way to be able to say, how can we help?
We had families in all the time, and so I know a lot of us really struggled when we had to basically close our doors to families.
We were sort of scrambling and mobilizing to find a way that we could still include families in our family-centered practice model. And one of the ideas was virtual rounds or video conferencing. And we didn't have the means to do it, so the foundation provided us with a couple of iPads.
The foundation to supply iPads so that we could still communicate and the families could see their loved ones meant so much.
We had families from all over the country coming in to our virtual meeting rooms, and it was a really beautiful and meaningful and interesting way of connecting with people.
Immediately when things started to kind of shut down, we reached out to Brendan, our executive director here, and we said, let us know what we can do and how can we help you and how can we support you. We actually ended up doing quite a bit of work. We managed all of the donations from the community into the hospital, and so we had very generous donors who came in and helped fed a lot of the hospital staff while they worked on shift. We also helped coordinate all of the personal protection equipment that the community wanted to donate.
It's just made it so much easier to know that they were there, and if we had any requests, I think they really stepped up and helped us do our job better.
As much as there were hard days, there were dark days in that process. We come out of it with so much resiliency of being able to look back and see how far we've come, see what we learned, see what we had within us, and really understand just what we are capable of.
Our team just rely on each other. We believe in each other. We care for each other. And top that with a community that really supported us throughout. It was overwhelming support that the community have given us.
I really hope that we continue to take those lessons with us, and that not only as individuals, but as a collective organization, as a hospital, we can really lean into that resilience and embrace it and use it for great things in the future, as well as being ready for the next wave.
Everyone came together as a team. So I feel like the foundation came together with Abbotsford Regional Hospital, and we worked really well together and supported each other, and we were able to show that we could help more than what we do already. So we became even a closer family as we worked together.
COVID being such a scary pandemic world problem, all of these guys, frontline workers, the nurses, they're going in there, right? They're doing everything they can. They're rushing in to help the patients, touching these patients. And to me, that's kind of the major thing, is I'm working with heroes.